What's up, Ramblers? Your favorite CEO is back. And before we begin today's podcast, make sure you hit the subscribe button to never miss an episode. And follow Assistance HQ and Offsource HQ across all platforms to stay up to date on the latest content, updates, and more. And remember, if you need a virtual assistant, visit us at offsource.tech. Now, before we begin, a word from our sponsor. Hey guys, welcome back to another wonderful episode of The Ramblings. I'm your host, Angelo Roberts, and I have today with us Adria Gross, the owner of MedWise Insurance Advocacy, which I actually just recently learned about when I met her at Master Networks. How are you doing today?
I'm doing great. How are you?
I'm doing absolutely well. So I absolutely thank you for joining us today. So I'd like to know a little bit more about MedWise. Obviously, the audience would. So tell us a little bit about yourself first, and how you got to MedWise.
Well, I grew up in a really small town called Port Jervis, New York, where Pennsylvania, New York, and New Jersey come together. And when I was 11 and a half years old, I was in Hebrew school, did not feel well. We had a map of Israel, had to write down the cities. And all of a sudden, this thing came on me. Finally, the rabbi who was the teacher allowed me to walk down the hall, sat in a chair, went into a coma, and woke up 10 hours later at a Catholic hospital. And when I opened my eyes and looked straight ahead, I saw a cross on the wall thinking I was in heaven, but that's not what happened. To the right was the rabbi, to the left was my parents. I'm like, holy cow, I can't believe that I'm here in a hospital. And from that day on, I lived with epilepsy for almost 25 years. I used to average 18 seizures a month, and at one point I was on 32 pills a day, but never controlled. And finally, I had a left temporal lobectomy after after living with the seizures for so many years, and had the brain surgery. And then after the brain surgery, I changed my career, where I did have a degree in education. They wouldn't certify me to be a teacher because I had epilepsy. It was before the Disabilities Act of 1990.
Okay.
So I was pretty much screwed. But after the surgery, now it was my chance to try and screw other people with insurance companies.
Okay.
So the first company that hired me, I worked there for 2 years. Within 2 weeks, he taught me how to deny. And then
When you say deny, what do you mean by that?
In other words, claims denied. So when you get a claim, and I'm sure the people who are listening to this, not every single one of your medical bills have been paid. So what happens is when your claim goes into an insurance company, now it used to be done by individuals, but now it's pretty much computerized, where they find a reason through their own computer why to deny the claim. And there are a lot of claims out there denied, and it could be for multiple reasons. It could be for an incorrect diagnosis code, incorrect procedure code. Like even today, I was sitting here, I'm submitting bills for an individual to, sending the bills on behalf of the providers for the individual to Medicare. And on a lot of those bills, they do not have an NPI number, which is a National Provider Identification Number. They don't have a federal tax ID number, which is the federal tax ID number for the provider.
Okay.
Under those two things, they would deny the claim. So also need the diagnosis, they need the procedure codes. One provider I called up, all he had was a receipt. And I said, hey, NPI, federal tax ID, diagnosis, procedure codes. I need all these to try and get money back for the client. And I got with you. At first, he had me a little upset because he didn't want to give it to me. And I'm like, hey, you know what? I'm going back to your patient and tell him that you don't want to provide me with this information, so I can't submit the bill.
So they actually have like systems in place to like actively look for multiple or even any kind of reason to deny a claim.
Right. That's what's going on now. And like, if he didn't have the NPI, if he didn't have the federal tax ID number, if he didn't have the diagnosis, if he didn't have the procedure code, ka-ching, no payment.
Oh, now who controls like that information? So who's responsible for making sure like that the information is correct?
Well, that's another issue. A lot of times I own a medical billing business, which I'm not taking on new clients. Most of my work is advocacy.
Mhm.
But as for a medical billing business, they are required to have this on the 1500 forms when it's not a hospitalization. 1500 forms are for separate providers who are not hospitalization. Like even if it's a lab bill, they usually the procedure codes start with the number 8. So they have to have the list of the procedure codes, you know, as for how much you're charging per procedure code, including the diagnosis and the NPI and the federal tax ID number
What
for
is
the
NPI? Just briefly, because
National
literally.
Provider Identification Number. So if you are a social worker, psychologist, psychiatrist, any type of doctor out there,
Mhm.
you have to have a National Provider Identification Number.
Okay.
When you type in, like, let's say you want to find out information on that provider, and you type in NPI on Google, you're looking for something, it will give you the address and usually the phone number of that provider with that NPI number. Now, let's say you don't have the NPI number. And if you have the time to go look it up, you can go on NPI, National Provider Identification Number, NPI, and type in the name of the doctor and the location, which I think is usually stated, also might be city, but it will then provide you with the NPI number for that provider. What
Is this
you're not
public information?
find, yeah, what you won't be able to find is that federal tax ID number.
Are you there?
Yes, I'm here.
Okay, I feel like I briefly lost you for a moment.
I think you might have.
All right, that's fine. I can always edit.
Okay.
All right, so we were talking about MPIs. And my question was, you had said that there was a website that you can go to look up either the doctor or the particular person's NPI number.
Right.
Or if you don't have the NPI number, like you can go look it up like that. Is this like public information, like a public website? Do you or do you have to pay?
Yes, that is public information for the NPI. You can easily find it. It will give you the NPI number. Plus, it gives you the address of the provider, possibly their work address, their mailing address. It will
Wow.
Yeah, yeah. And like if you only know the name of the provider and you don't have the NPI, you can look it up that way, either by state or city or both. And then if you already have the NPI, you can look up the NPI to find out more information about that provider.
Okay. Now, in regards to who's like responsible for like the information that the insurance companies are looking for to deny, is that like done like by the hospital? Is the client like supposed to take care of that?
So a bill that I had today, here's a fine example. They take any insurance. And the patient went ahead and paid it.
Mhm.
But the bill, and they were nice enough to send in the bill to Medicare. And I spoke to Medicare last week to find out how much was paid. But he has this client of mine who was a patient also has another insurance policy, which is secondary and is one of the commercial insurers. So what we need is to be able to identify the information with his secondary insurer as for what Medicare has paid on it. Another issue that I see happening, which happened in this case, is when you apply for Medicare, you normally, if you're going directly with Medicare, normally what happens is you hopefully have another insurance or a supplement, and Medicare has to cross-reference. The secondary insurer has to connect with Medicare to cross-reference it. So you will not have to submit the explanation of benefits and payment when you get it from Medicare to the secondary insurer. So you really need to make sure that the crossover has been done through the secondary insurer to Medicare. In this case, with this gentleman, they never did. So last week I was on the phone with the commercial insurance and Medicare saying, hey guys, let's get it together. So it doesn't have to be submitted twice.
Right. Now, how often would you say that these kind of mishaps happen, like within this particular field?
People only come to me when they have problems. How many times it happens, I don't know. I have read all over though that 80% of medical bills are not done properly.
Now, okay, I don't know if you're into conspiracies, but do you feel like there's a big pharma conspiracy for medical billings to be like so high and inaccurate? Which I don't want to say people are not good at their jobs, but maybe there might be an incentive to not be as fast or as accurate, to help maybe slow down the process. In turn, 80% of people, obviously that's a large, probably in millions of numbers. Most of them probably don't know about insurance advocacy or how to get that return, and so they end up keeping that. Do you have any thoughts on that?
Well, the thing is this, a lot of times the medical providers do not know how to submit the claim correctly. A lot of times they go to an outside billing company, and the outside billing companies, what they're doing. But the other issue comes along. Listen, the first payment is going to be the highest, because then let's say your insurance company pays out 60, 70, 80%.
Mhm.
Then the rest has to go to the supplemental coverage. If please you have something like people on Medicare usually do. But let's say you are under 65 and
Mhm.
your insurance company pays out 60, 70, 80, or possibly 90% of the claim. With Medicare, it's usually 80% they pay out. Medicare pays it out, and then you go to the supplementary. But if you are under 65 and you don't have Medicare, they usually pay out between 60 to 90%,
Mhm.
and they're responsible for the difference. But
Mhm.
the thing is this, when the insurance company gets the medical bill from the provider, a lot of times there's missing information, and that's when they don't pay it. Also what you'll see on many medical bills, it might be missing information. They might be charging you the same thing, possibly 3 to 5 times, and they're not going to pay that out 3 to 5 times, because look, the sad thing is that we don't see our bills before they're submitted out in most cases. If you pay up front and the provider's out of network, then in most cases, not always, but in a lot of cases, you're going to have to submit that bill yourself.
Mhm.
Even when you look at the bill, you should see if they're billing you more than once for the same thing.
Wow. So are they purposely like double billing you?
Well, yeah, people want money, and Angela.
I like to try to sometimes give people the benefit of the doubt, a little bit new for me. I'm not necessarily into this. So how did you go from the deduction of things like denying people to being an advocate?
Well, I used to be denying, and then I left the insurance companies because I was adopting children. I adopted 2 kids, and then I kept my feet wet, went to one of my doctors, and I said, hey, you know what? I used to be on the other side denying or paying, but now I want to learn how to submit.
Mhm.
They taught me. And then I opened up a medical billing business. But then, like a year after I started the medical billing business, this gentleman came to me and he said, I'm happy that you're running the business, but I need help, and I think you can help me. So he had a bill. He had polio as a kid, wound up with MS, and
Mhm.
he's in a wheelchair. And he's in a wheelchair, is in a hospital. It was, excuse me, it was in a restaurant that was supposed to be handicap accessible, which it wasn't. And he fell off the wheelchair and wound up in the hospital twice.
Oh my gosh.
He's got a lawsuit against the restaurant.
Mhm.
Hey, you had a sign outside saying that, you were handicap accessible, which you were not. Otherwise, I wouldn't have fallen off my wheelchair.
Right.
And so he was taking them to court. Now, before it went to court, he came to me and he says, hey, I know I helped you start this medical billing business. Can you do me a favor? Can you look at this? So I did. I was able, he had literally 30 pages of bills, 25 lines on each page.
My gosh.
And when I looked at the procedure codes and I looked at the diagnosis, I was able to determine what was related to the injury, was not, and what was questionable. So when we took that questionable and non-related away, his bill went from 108 down to 22 grand, and that's all he had to pay when he won his lawsuit.
Wow.
Yeah. So that was my clue on what I can do to help other people.
I didn't know medical bills got that high. I mean, I knew, but like to hear $118,000.
Yeah, it was 108,000. I have a bill on me right now. I mean, I've handled cases over $1 million, and right now I have a case where the insurer is taking the money back, and we're talking over $2 million. Some of them are over $10 million, but I have a case right now that's over 2.
Oh my gosh. What would be a cause for $10 million worth of work?
Well, this was cancer.
Mm.
The guy was at a cancer center, and bills add up.
I feel like in that situation, why would that be the oh my God. Okay. So you switched, you're in advocacy now. What are some of the key differences that you're seeing between submitting versus denying, and how are you combating like the both of those?
Well, there's really no difference. The only thing is that when a claim is denied,
Mm.
you have to make sure that you read the policy. You have to look at the policy from your insurer to see what's covered and to see what's not covered. And it's every single policy. So if you're questioning why it's not being paid, and you look at the explanation of benefits, your EOB is an explanation of benefits you get from the insurance company, it has to indicate on the explanation of benefits why they're not paying.
Mhm.
And you have to look at the reasoning, and then you have to look at the policy, what's covered, what's not covered, and to determine whether or not they have a right to deny your claim. They might.
Mhm.
I don't know, because every denial is different.
Right. Okay. Now, you've been doing this for a very long time in a sense. What would you say is probably your greatest win in terms of maybe either getting a claim down or just, promotion? What would you say was a point where it was, I've made it. This is what I'm doing.
Well, within a month after I started working for the first insurance company, they made me a supervisor of claims. And I worked there for 2 years. I went to another insurance company. My first job there I was in charge of a few accounts. I looked at every single, I was helping write the policies, and I was processing the claims. And when someone would bring up the fact that this should have been a paid claim and why are they denying me, and I look at the policies, I have determined what to say to the insurance company to twist their arm to make them pay it.
Mm.
If it's something that has to be covered,
Right.
learned how to make them pay it.
Okay.
Yeah.
Now, I kind of want to switch gears a little bit, go into a little bit of biz dev. You've obviously, as you mentioned, started a business before, did this. What was your key instrument in growing your business? What was your channel that allowed for you to have growth? Was it, say, chambers, networking, maybe good advertising and paper?
Okay, advertising hardly ever worked for me.
Okay.
Okay, there was an organization where they just help people with medical bills, and I would advertise on that. And I have to tell you, that helped me quite a bit. I belong to a couple associations. First of all, there are very few of me out there who really know this work, which has been an advantage for me. You know, as I said, I am one of the few people who have been in this industry so long. So I have a lot of advantages. Okay.
Right.
Most companies out there, you're not going to get this advantage. The fact that I am a national company and I cover every single state, like right now, I have a case where a guy is in the Philippines. He's not even here in the United States.
Oh.
And I'm trying to get him back here to the United States for his sister to take care of him. He's been in a hospital, right? It's almost 2 months now. It's today is August 29th of 2022. He's been in this hospital in the Philippines since July 6th. So we're almost up to 2 months. And he's had multiple different diagnoses. It's a whole long story, but I am going to try very hard to get him back here to the US when he's stable and being near his sister in a hospital where he's insured. It's a large company. And this insurance company also has their own hospitals. So big conglomerate, and I'm trying to get him in her state. I want him back here and in her state to be taken care of because she will help him. She's in the Midwest. He's from the West Coast. But we all want him back to be near his sister in the Midwest. So I'm working on that case right now. And the sad thing is that it's been 10 days since I got a hold of that. I've sent to his insurer who sent me off to another department 10 days ago. We have gotten nowhere. And I'm really angry. So I am going to get back on the phone with a company in Europe to say, why is it that this company came to you 3 days ago and you haven't responded? The guy is in a hospital. You know, why are you not working on this? So that's when when we're done with this, that's my next phone call. These are really, I mean, I'm lucky, I'm blessed that I've had this experience, but you really need to know. And a company like mine, people who are in this situation, it's not just like a chamber of commerce in a city, town, or county. It has to be national. Right. So it's hard for me. But what has helped me the most is publications. I lecture before attorneys, CPAs, and financial planners. I also wrote a book that Ralph Nader liked so much he won an international edition. Between the lecturing and the book and the articles, that is what's really helped me with my business.
Okay. Now, I guess switching gears, because I just thought of this, because I'm hearing a lot of sad stories, and I'm realizing kind of that certain industries are not necessarily the happiest. There's not a lot of sometimes people deal with sad stories. And so my question, especially in 2022, is like, how are you mentally managing the load of like positivity versus, say, some of the negativity within your job?
Well, that's why I put the book out. Some people don't have any money to afford to work with me, and the book will hopefully help them. And I do advise. My time is limited, but people have to really try to educate themselves to get help. They have to try and also help themselves. If someone can afford, I do not have a nonprofit organization, but as I said, I do lecture a lot to educate. That's why I also put the book out. I really don't make any money on the book, but it's just, if there's education out there that will help people.
No, I think you might have misunderstood the question.
Okay.
I'm asking, how are you mentally managing the negativity of some of the situations that you have to deal with on a day-to-day basis?
I get the amount of pressure, that goes on.
There's a lot of people's lives at stake. There's a lot of people, you're hearing people's, very intimate and bad stories.
Yeah, and some are awful, but you know what? If I feel that I can't help them, I'll tell them, I'll be upfront with them. But when it's something that I really feel that I can help them, I know I can. because of my experience. And when everything is done and over with, and I get the case settled, I get tingling throughout my body because I have been able to help this person.
Mhm.
Take chills. And that's what every time I think of a case and I think of the hard work and how difficult it is, I know if I'm going to be able to overturn this case, I'm going to feel fantastic when it's done. And I do. It's like every time I'm like, oh my God, oh my God, oh my God. But I know that at the end, it's going to be resolved.
Mm. Okay. So what does a day-to-day, basis look like for you in terms of the work that you do?
Every day is different.
Okay.
Yeah, like people say, what do you do? How many hours for this? How many hours for that? I go to bed and I think about what I have to do the next day. I wake up in the morning thinking what I have to do that day. Like for you and I had this time set aside just for you know, for us to talk.
I do. Thank you.
Every day is different, I can't say an hour of this, an hour of that, plan it. Because it's like when people own businesses, the first thing you need to look at is what's on the burner, what's cooking right now that you have to get to immediately and it can't wait.
Right.
That's how you have to look at it.
Okay. Okay. So you've been doing this a while. You're very experienced in this. What do you have planned, going forward?
Well, I have 3 more books I want to publish.
3. Wow. Okay. So do you want to transition into also being like an author? I mean, yes, you're already, you've written a
I
book.
love what I do. I can't leave this because I know there's going to be a need, possibly as long as I'm here on the earth. But I have 3 books I want to do, and it's all about having a condition and having respect for others. The next 2 books is going to be about that. One is going to be for anybody, and the book after that will be third graders. Because, look, when it comes to someone having a disability, because I was with a disability for, you know, 25 years of my life, people rejected me. They didn't want to be with me. They were scared of me. And people out there who are normal and really don't have conditions like this, they might be scared of others who have a disability. So I want to get that smoothed out. I don't want people to be scared or have fear to affiliate themselves with someone else who has a condition, because it happened to me. And after I had brain surgery, I felt like, now you want to be my friend? There's something wrong here. And that gave me the idea for the next book. And the next book is really not gauged for children to learn this when they're young. So that will be my 4th book.
Wow. Okay.
Yeah.
Books. So you said that you could never not do this. Do you feel like you could do MedWise until you're gone out of here?
If we never go into socialized medicine, every single claim out there is paid, and they don't kick people out of a rehab too early, and they pay for your long-term care policies, without a blink, I won't have my business. That's okay.
That would be
But
good though, I think in that sense. I think that would be, I always say, if there's something good in that sense that will put me out of business,
right.
I can't be mad. I'm sure personal injury lawyers wish, something would put them out of business, but
Oh, that would definitely put them out of business. They can't sue for an injury.
but I don't think would be conducive to what a lot of people want. So I want to get into something a little bit personal, right? You mentioned living with disability for 25 years and like kind of having this bounce back revenge period, getting, over on people that, were there. What was that transformation like in that process that brought you from, there to what was that moment that you
Yeah,
felt?
so my life went twice 180 degrees. Okay. I was healthy, I got sick, that was the first 180, and then I got well.
Mhm.
And I was happy. I mean, look, it was a hard decision for me to decide whether or not I wanted to be disabled for the rest of my life. You have people out there who there are results for, you know, who don't even want to do it because they love being on disability. There are people out there who don't want to work and get themselves on disability, where I love to work. I love to help, you know. So I had been given the gift to be healthy, and I don't regret what I did. But my heart goes out to those who are not healthy, who have a problem, and I don't like the way they're treated. And that's why I think it's important for people to be educated, to know what it feels like to have a disability and be rejected. You know, I've forgiven all the people. I mean, I have people in my upcoming book who knew me before I got sick and who knew me after I got sick, and they still know me today. And they wrote about me. They wrote about what it was like to be with me when I had a disability. I think that's really important for others to understand that. But, you know, people have to be respected all the way. I don't care if they're a senior, I don't care if they're a child, I don't care if it's a religious, ethnicity, race. People all deserve respect. And and that's why my next two books are going to be about that.
That sounds amazing. Now, I want to get into a little bit more business, right? So MedWise is, as you said, international in this particular sense to a degree, but national. How many employees are with MedWise, or is it just you?
I have part-timers.
Okay. Um, what are you thinking about in terms of scaling?
Listen, COVID killed me. Everybody was in the hospital, had COVID. Everything was paid by the government. They didn't have to worry about any bills. So I had to say goodbye to some of my people. And now slowly the business is picking up again, and I'm going to have to bring more people on.
What do the people really, what does a day, I guess, what kind, okay, I'll start like this. What kind of part-timers are you hiring?
What kind of what?
What kind of part-timers? So like maybe assistants, underwriters, call staff.
Yeah, I have people who do my bookkeeping. I have people who do clerical. I have people who I can show how to do Excel sheets that I might need to bring to court or even return to an attorney.
Mhm.
I have people who help me write articles. You know, I have all different people out there.
Okay.
Yeah.
Now, you, I would assume in this particular sense, do a lot of work, and this seems like a very paper intensive kind of environment. How are you balancing that with like your normal day-to-day life?
I try and find time for myself. And sometimes I'm working 7 days a week, you know, but I try and look, when you have your own business, and let's say you have to go to a doctor's appointment for yourself, it's easier to take off the time to do that, to arrange, you know, the time. If you're working for somebody else, it's much more difficult. You want to take a vacation, which I really don't take vacations at this point, but I could also bring my work with me if I wanted. But it's easier to even plan your own vacation.
When's the last time you've been on vacation and what did you do?
Oh, I haven't gone anywhere for a long time, but my last vacation was um, I took a little vacation, little over a year ago to visit a family member in the Carolinas.
I used to have family in the Carolinas. I actually almost went to East Carolina University. So I made a couple of different decisions. But anyway, so before we get you, I have to get you out of here or anything. We always like to end on like a super, super good question. If there were any, now I'm going to make it specific because I want to see if I can target this. If you were to talk to someone who is listening to this, who might need a medical something, because we never know what people are going through, what would you tell them to do if, let's say, they couldn't afford you, but they wanted to be able to reduce whatever kind of medical bill they had, or even seek help? Where would they start to get information on what to do with, their medical billing issue?
Well, first of all, I have quite a few videos on my website, and you can listen to them. You can listen to them all day long, and I keep on making new ones. And it always gives you advice. If you want to spend $13.95, you can order my book. You can get it on Amazon. Um, there's so many articles out there. I have over 4 pages of publications. Um, people have written, I've given advice for a long time now to help people. So you really have to, look it up, take the time to study it. But the one thing that I can say is if you have a rare disease, if you really can't afford it, if you have cancer and you need help, there are associations out there that you can reach out to for guidance. And some of them might be able to help you. So I would recommend that. And the other thing that I always recommend people, this is so stressful, this type of work. And it's very hard on people when they cannot afford my services, they can't afford their medical bills. You have to ask for help. And and the one thing that I want to say is, and I tell people this all the time, don't ever give up. Don't ever give up, because if you give up, if you don't keep yourself strong enough to continue on to get this resolved, where are you going to be? People call me up, and I know if they can't afford me, I might try and send them out to an association. Look it up. See what associations are out there that might be able to help you at no charge. And some of them will. Like even if you're a senior and you're on Medicare, you can call your Department of Aging in your area. And a lot of times they will help you at no charge. It's paid for through our government.
Wow. Okay. I didn't know that. I'm glad. I hope that helps someone that's listening. Very wide audience. So I really hope that helps. Before we have to officially get you out of here, you mentioned the website. What is that website? Where can people find your information if they do wish to contact you?
So my website is www.medical. It's not MedWise. www.medicalinsuranceadvocacy.com. www.medicalinsuranceadvocacy.com. My phone number is 845-978-9493. 845-978-9493. Again, my name is Adria Gross. Just look me up by name. You'll find me. And call or email me. That's the best way to reach out. Thank you so much.
It's been absolutely wonderful having you. And we thank you so much for joining the show today.
Thank you.
Hey, Ramblers. That's it. Podcast is over. Don't leave yet, though. If you enjoyed today's episode, make sure to like, share, and subscribe to the podcast, and follow us on YouTube at OffSource HQ. We'll see you next time.